Mechanical jaundice. This is last topic today, and this is common complication of pancreatitis and cholelithiasis. First of all, there is classification of jaundices: pre-hepatic or hemolytic, hepatic, hepatocellular, and post-hepatic or cholestatic or mechanical jaundice. Hemolytic, this is often in children. Hepatocellular, this is physician disease. Typically, this is cirrhosis. This is not surgical disease. And we will study post-hepatic mechanical jaundice. This is surgical disease. Classification is the jaundice is divided by classes: class C, class B, class A. Here it is word class, you understand. Mistake. Mechanical jaundice by the severity is divided into these classes. Why? This is international and Russian classification, because postoperative mortality from treatment and complication, they strongly are connected with total serum bilirubin, strongly. Etiology. There are many diseases that can cause mechanical jaundice, from malformations, congenital diseases, and benign diseases like strictures and stenosis to inflammatory disease. You should always say it at the exam by the groups: benign, malformations, inflammatory diseases that we study today, tumors, different malignancies, all hepatopancreatic biliary organs. All of their malignancies can cause mechanical jaundice as parasitic disease, group of parasitic diseases. Differentiation of jaundice. From this table, you can see classical differentiation of jaundice, but you should remember all of these symptoms cannot accurately make differential diagnosis of jaundice type. Why? Because stool color, a holy color, it comes while bilirubin will not come to duodenum. And why does it not come? Mechanical obstruction. But if mechanical obstruction is not total, stool color can be not alcoholic. Urine color, this is intoxication of bilirubin by the body. If there is not big intoxication, urine color can be normal. Do you understand? Because of that, the only method to understand that it is mechanical jaundice is ultrasound. Only dilated biliary ducts in ultrasound can say, yes, this is mechanical jaundice and not another jaundice. Signs and symptoms. You should remember, mechanical jaundice has itself complications: cholangitis and sepsis. Charcot-Striate, this is symptoms of cholangitis. You should remember it very good. Pain, jaundice, fever. Renal spin test. This is Charcot-Striate cholangitis plus septic shock and mental confusion. Renal spin test. This is symptoms of septic shock. Physical examination. You should look at these symptoms plus skin color and eye color. Plus to this, you should look at the symptoms of diseases that cause mechanical jaundice. On ultrasound standard investigation, you can see dilated extrahepatic bile ducts. This is accurate method to understand that mechanical jaundice is mechanical. The jaundice is mechanical. But if you need to understand better reason, you can also make cholangio-pancreatography and MRCP to understand the reason of mechanical jaundice, to make differential diagnosis by etiology. Look here, very big, dilated bile duct. MRI, also big, dilated bile ducts. ERCP, percutaneous transhepatic cholangiography. Why are they all made? To understand reason of the block. Gallstones, malignancies. Do you understand? If it is malignancy, you should make biopsy. Because of that, it is very important. Ultrasound, this is screening method to understand that jaundice is mechanical, but to understand the etiology of the reason, you should make another investigations. Here you can see endoscopic retrograde cholangio-pancreatography. Stones. 2 stones here. Percutaneous transhepatic cholangiography, exchanged bile ducts, and here block. Such a block is often because of malignancies. Contrast and change computed tomography to see if there are masses, malignant masses, that can be etiology of mechanical jaundice. And here you can see malignancy, cancer of pancreas. If you have malignancy, you should make biopsy. Malignancy, this is always histological diagnosis. You make core needle biopsy. Here it is malignant tumor in head of pancreas, and you should make biopsy. This is core needle biopsy under the guidance of endoscopic ultrasound. This is gold standard now for diagnostics of malignant tumors of hepatopancreatibiliary zone. Treatment: mechanical jaundice, biliary decompression. If it is cholangitis, resuscitation plus antibacterial therapy. If it is cholelithiasis, the reason of mechanical jaundice, then you should make lead extraction. Benign biliary structure, balloon dilatation. Management strongly is connected with etiology. Because of that, you should make correct diagnosis. If it is pancreatic cancer, you should make full TNM staging, and if you can, you should make WIPO procedure, pancreatic duodenectomy in resectable case, and unresectable palliative treatment with biliary stenting and chemotherapy. If it is helicarcinoma, also full staging, and then you should understand, can you make surgery or not? Choledocholecysts, different types of choledocholecysts. You should simply know that choledocholecysts, this is benign disease, congenital disease with different types. You should make hepatoionostomy with resection of these sites. Biliary decompression, different variants, integrate percutaneous transhepatic cholangial outer drainage with stenting here, or retrograde by endoscopic transpapillary biliary drainage. Here you make retrograde stent, endoscopic biliary stenting, and you restore passage of gall. Thanks for your attention. Goodbye.